So lovely, lovely, lovely to be here. And I know that I am between you and the cheese and crackers and fruits. There is no libation. No, there's wine. Okay, there, okay, because Camille called out having wine and cheese later. So I'll condense what I have to say, as Sophia has also crystallized some of what we've heard coming up as themes out of the workshops. So I hope to just share with you some of my reflection and hoping that it can be instructive to the work that is our continuing work. I begin with just picking back up where we started this morning around Indigenous land acknowledgement, and particularly in the wake of Truth and Reconciliation. For us in this room, as large majority Black folks in this room, I think we must never forget that the constellation of Indigenous peoples' dispossession is based on legal constructs encoded in legislation in this country's history. And we must recognize that Indigenous peoples' marginalization was deliberately manufactured. Yeah? So, you have the Indian laws, the Indian legislation, the Indian Act, is that those are construct of this nation, Canada, that has created certain conditions for Indigenous people. And therefore, as immigrants, particularly those of us who came under the promise of multiculturalism and or who today come because globalization pushes us to leave our home to find home and work and viability elsewhere, that we must recognize that the promise of multiculturalism and this thing called globalization that have us fleeing our home has also been held and has enabled, I think, sometimes the erasure of Indigenous peoples and their exploitation. And that it has also created and conditioned sometimes explicit division where the state positions us, and I will identify myself as an immigrant to this country, they position us as immigrants as more desired than the Indigenous people on whose lands we were brought to. And that some of us who came here through the transatlantic slave trade, Black people, African people in this room, that we were forcibly brought here as, I believe, a stolen people to a stolen land. Hence the need, I think, for all of us who came after and who seek to work for justice in this country to be in solidarity with Indigenous peoples' fight against colonization and for the rights to land and sovereignty. I think it's important framing for us as Black folks so that we see that our sites of struggle intersects with other people's sites of struggle, and particularly with Indigenous people's sites of struggle, because oftentimes there is a polarizing conversation that happens that says Indigenous people are getting this, Black people are getting that, Indigenous people saying Black folks are getting this, and Indigenous people aren't getting that. And I just want us to kind of always be mindful of those kinds of positionality, because I think they can serve to really erode the kind of alliances that we need, that I think we've heard echoed through this conversation. Thanks to the organizers for this gathering, so Commons Solutions Lab, Black Health Alliance, Sinai Health, and particular thanks, I think, to all of those folks who have that little yellow band, who have been anchors in making and creating space for us to have this kind of conversation. Particularly in this moment where Ontario's redesign of the healthcare system is happening, and amidst, I think, what we're sitting in is the legacies of Black Lives Matter movement and centering and naming and addressing anti-Black racism. Thanks particularly for the focus on collection of race-based data to reveal differential disparities and to inform the identification of strategies and action to improve the health outcomes for Black communities. Your work in naming the sites of inequality, particularly naming the construct of race and racism as operating forces which produces systemic inequality, marginalization, individual harm, the daily battles with microaggression and ill health is, I think, something to be applauded. So thank you. I also want to say a particular thanks to Karen, who spoke as from a user, client, patient of the healthcare system. Because sometimes we are used for our experience and only that. Yeah? But this gathering has ensured that the centering of the patient experience, the client experience, is instructive for the changes that we need to make. And I think one of the, for me, what resonated for me in the comments that you offered in your personal story is the thing that is an echo for Black people in the healthcare system, and particularly Black people who are living with and surviving mental health illness and mental health trauma as well, is that oftentimes our entry to access quality care is through the criminal justice system. And therefore, as we do this work, and I think other speakers spoke to this, is that there needs to be some intersecting conversations between health and other parts of the system, because where Black folks enter healthcare is not always through the doors of a hospital. So thank you very much for risking sharing and being as candid as you were to bring that into this space. And thank your mother for being here as well. Black mothers. As I said, I'm an immigrant. My mother came here as a domestic worker. My mother worked for over 30-something years at Four Seasons Hotel as a housekeeper in the housekeeping department. My mother, as a domestic worker coming here, left myself and my sister, 2 young children, to be cared for by grandmothers, so I'm a granny girl. She came here and she experienced the exploitation of this space and what happens with domestic workers, now living caregivers. My mother could have been one of the folks who were sent back and deported because she didn't have her status when her contract ended with her employer, and so she applied behind her employer's back for her landed status, and the employer then promptly took her to court for the price of the plane fare that he paid for to bring her here, as well as the cost for food, steak that he claimed she ate without his authorization. So I share this because we all come with a story. And sometimes we come with stories that are invisible. And therefore, sometimes when we respond as Black folks in the system, in engaging the system, folks don't understand the legacy of what's behind you. So I was just with a sister who talked about responding in particular ways in engagement with her healthcare provider when speaking to symptoms that she's experiencing. And the healthcare provider is, well, it's because you're angry. But the healthcare provider is not able to see the history that is brought into that room, why anger needs to be present, and or why frustration is present. And we know when anger gets named and twinned with Black bodies is healthcare services and needs disappear. So these are some of the things that we walk into the room with that I think we as Black folks in service, as allies in service, need to always remind ourselves of, but also remind our colleagues of when they talk about the angry Black client, the demanding Black client. And we've seen that in the school system where they have sometimes annexed Black parents from school system because they are strongly advocating for their young children. So we're at a critical juncture, I believe, at this moment related to how data, quality, and equity must be triangulated to enable the creation and sustaining of a healthcare system that can challenge disparities among populations and geographies. Addressing these disparities, I think, begin with a fundamental step of bringing the nature of these disparities and the groups at risk to light. And we bring that to light by collecting the data. Yeah? It doesn't mean that collecting the data is without risk that we need to respond to and ameliorate and strategize to mitigate against. But I think it is imperative that we work on the collection of data that can be stratified by race, ethnicity, language, gender identity, sexual orientation, income, etc. Because Black communities have been asking for this for a long time across many systems, though with caution. Yeah, we've been asking the police to collect race-based data because we knew that we were being carded more than anybody else. Yeah, but we wanted caution about how the data was used, who had ownership of it, and we wanted to be part of the analysis and the building of recommendations that are responsive to those needs. So I believe that action on this in Ontario and Canada-wide has been slow. And I would suggest that one of the reasons is that Canada has been and continues to have great reserve in naming racism as part of the Canadian experience. We instead paint the picture of Canada's multiculturalism and point to folks south as those who really have a need, where there is a particular prevalence of anti-Black racism. But I think, our current Prime Minister and his the revelation of the Trudeau in blackface and brownface really, I think, pushed open a door into the very, very presence of racism in Canada in its overt and its benign ways, and how it can just happen. Yeah? And it can happen and be dismissed as youthful foolishness. But it happened and we were not, as Camille said, surprised. Yeah? And funny enough, I found that Black folks and racialized folks were the ones who were like, boy, I'm willing to overlook that, or look beyond that. I'll hold you accountable, but I may still choose this government over another government. So that was an interesting piece about, as Black folks and racialized folks, how there was a criticality, there was a critical analysis lens that we brought that I would say, I will speak a little bit later to what this thing called provisional alliance is. What is it that I may need to be linked to right now? It may not be my long-term future, but it may be my short-term, yeah? So I believe that people made some short-term strategic decisions. But we're in a system that is reluctant to acknowledge racialization as having impact and implications for access to and provision of competent health, access to responsive services, and closing the disparity gaps. And that makes it particularly challenging for us as Black people. This second gathering is, however, I think, a clear response and demonstration of the success of the work being done in communities and by community activists in demanding that the collection of race-based data in healthcare be done and that it be attached to strategies that will address the sites of our inequality. Others in our system are doing that work, and we've heard. So the Toronto District School Board have been long time collecting race-based data to show how the educational achievement gap, and they've done that disaggregated by race. And recently, through the work and leadership of Notisha Massaquoi, who was here earlier on the first panel, as co-chair of the Anti-Racism Advisory for the Toronto Police Services Board, was recently responsible for producing the first mandatory race-based data collection policy for police services in Canada that became effective January 1st this year. We also heard and saw that the child welfare system through the Children's Aid Society was pushed and exposed about the need to collect race-based data to spotlight, to reveal, uncover the disproportionality of the young Black people who are being taken into the child welfare system, and therefore a call for response to address that. I framed my remarks and titled them, If Not Now, When? Leadership, Allyship, and Action, because I believe it is, after all, 2020, yes? So if Trudeau can say that, I can say that too. So I assert to leaders in this room and influencers in this room, and I believe that we are all of that, that if not now, when? If not now, when? The body of evidence on the value of collecting disaggregated data by race, gender, income, etc. is clear for those who are present here today. So how do we move the agenda forward from all of our spheres of leadership and influence? I believe we have some tools. We have tools that were developed, the socio-demographic data collection tools that were developed in 2012, coming out of Sinai Health Systems. They're there. They sit with Toronto Central Lynn, Cynthia Damba, and others as part of that team, are holding some clear tools that we are using within the community health sector, that we have been using in some hospitals. And I think it would be a call from this table to have those tools continue to be spread across the healthcare system with a mandate from Ontario Health that those tools be used and implemented in the creation of these newly developed Ontario Health teams. I think that the government as leadership, we have the vision on Healthy Ontario Vision, and I think the Healthy Ontario Vision must include us. The sustainable healthcare system that is integrated, innovative, efficient, and able to respond to the short and long-term needs of patients must be, I think, purposefully built to support Black people in Ontario. And Ontario Health must affirm and include, I believe, a Black health strategy approach in their agenda. I think that there's an opportunity for this room to call for that. That there must be a commitment to the collection and use of race-based data to drive improvements in an integrated and in an integral and intentional strategy so we can truly assess delivery on the vision of what is good for all Ontarians. As leaders in organization and programs, I think we need to embrace addressing what physician and researcher Kamara Phyllis Jones calls the social determinants of equity. And that this involves collecting the data so we can monitor for inequalities, in exposure and opportunities, as well as for disparities in outcomes. That we must collect that data and do the work so that there can be examination of structures, policies, practices, norms, and values. And that we must require interventions on societal structures and attention to systems of power. We're talking about power. We're talking about folks who don't have the power to make change, folks who have the power to make change, who have not made those change, but also folks who have the power to demand change. And I think we have the power to demand change. Yeah? And because we are not sitting at the decision-making table doesn't make us without power. And I always harken back to that television moment when some of us saw how Black Lives Matter shut down the Allen Road, and the subsequent move and shifts from there, where we now have at the City of Toronto an anti-Black racism unit. And that didn't come about because John Tory felt that, boy, this is the right thing to do. Yeah? It came about because of these kinds of convenings and actions that were taken by folks who took risk in communities. I firmly believe that in our changing healthcare systems and structures, that as to be accredited as leaders, health equity and collecting equity data must be one of the key pillars in our organizations. If we are to truly advance a patient-centered agenda, we need to know who the patients are. We need leaders and influencers to name and acknowledge the presence of anti-Black racism in its manifested and how it's manifested in healthcare systems and structures and in care practices. Until leaders across health sectors can proactively name and respond to this issue, we will continue to waste precious time wading through denials and defensiveness, which only serves to exacerbate the problem. And I ask again, if not now, when? As Black people, racialized folks, and allies, we know that conditions that produce inequalities rarely exist on their own. Therefore, an intersectional lens is critical for us to understand that our multidimensional identities as Black folks can serve to compound our marginalization. Hence, we cannot afford to be essentialist as Black people. Yeah? I exist as Black, I exist as woman, I exist as, from the LGBTQ community, I exist as somebody who is an immigrant, I exist as somebody who comes from a low-income background. These are all of the things that brings me to this space in terms of who I am, and therefore the systems that we build must be responsive to all of those elements and how they intersect to produce poor health in our communities. So we are not always can do this on our own. So I believe that we must build allyship. We need to connect our strategies with that of others and be in solidarity with those who are also impacted by disparities and who have a desire to see that change, sometimes through the collection of race-based data or through the collection of other elements of data. We are never we're never in all of the rooms where change and decisions are happening and where deliberations are taking place. Hence, allies are needed so that they can be an echo in the call for collection of race-based data and in responding to anti-Black racism that reverberates where they are, where we may not be. So I think there's a call to action for the allies in this room that you need to be a reverberation and that echo for us in those rooms. And sometimes even when we are in the room, don't have the room turn to us to speak to the Black experience. We can speak to the Black experience, but in terms of speaking to the strategies of what is needed to respond to anti-Black racism is not just ours to own. Because I think all of our humanity, if we believe in this thing called equity, is reliant upon all of us being committed to carrying forward that struggle. Doing this work to push a system that moves at a glacial pace and is risk-averse to systemically collecting race-based data, I think requires the efforts of many. Hence, I believe, let us share the emotional labor with our allies. So, I'm saying Black people in this room, turn to the person who isn't Black sometimes and say, you carry this one. I can give you some language, I can support you, but you carry this one. Because we've heard previously that in the rooms when we speak it, it can be immediately dismissed. When we speak it sometimes, depending on the context, it is received as anger. When we speak it, it is heard as defensiveness. It is heard as confrontational. It is heard as demanding. So sometimes strategically, not because you're giving away your voice or you're having white people claim space on your behalf, but sometimes strategically, it is important to have white allies speak it. Yeah? I held one of these roles of health equity and community engagement, and I firmly believe that right now, some institutions need those roles to be held by white folks, so that white folks can tell other white folks what needs to happen, and not Black folks always doing that heavy emotional labor, because it takes a toll. Yeah? High blood pressure. So, doing the work to push a system that moves at this glacial pace, I think relies on allies. I also believe that to advance this work, we sometimes need to do what this French philosopher Jean-Luc Nancy calls building provisional alliances. And by that I mean that, you and I are not best friends. We will never be best friends. I know you don't like me, and we may never like each other. But right now in this moment, we have a common interest. So, an example, gross example, but it's just a gross example. So, we're in Sinai Health. So Gary may have a different vision for what he wants as resources within the hospital system, but I need Gary as an ally to help me ask for some things. So I may be in alliance with the hospital in demanding some things for community, knowing that in a different moment, the hospital may be demanding resources that I think should come to community. But there's a particular moment that says we could be in alliance about pushing for something. And in this moment, I think I can be in alliance with Gary to say, Gary, let us be in alliance about pushing for health equity, socio-demographic data collection. So I think there are times where we need to make provisional alliance, where there is mutual benefit to be connected for a single purpose, but we know that this union may not be a lifelong union. As a community doing the work to advance the collection of race-based data collection, let's agree that we will not always agree on strategies for collecting and doing that work. That there will be disagreements and contestations about many things, including how the questions are asked, what those questions are, the methodologies used, who is leading the charge in advancing the work, and many more. Our disagreements in strategies often gets exploited by others, as who are resistant to change, as they turn to us and say, and Camille echoed that earlier this morning, well, I don't think the black people seem to be able to get them things together. There's lots of disagreement, black community can't agree, and therefore we can't take action until they come to agreement. I don't see anybody saying all white people need to agree before there's an action that gets taken. Yes? Nobody's calling for that. Yeah? Nobody's calling for that. Nobody's calling for every white person to come to a common consensus before there can be a strategy that advances progression for white folks. Yeah? But racism, yeah? Racism makes it so that for racialized communities, we must always be in harmony on a single strategy in order for us to get something. And I'm saying, let's push back against that. Diversity is a good thing. We have diversity of opinion. There was a Condoleezza Rice, a black woman who worked for George Bush. I don't agree with Condoleezza, but I will fight for Condoleezza if she experienced anti-black racism. But Condoleezza and I will never share values about the George Bush era. Yeah? So why must we wait until there is this thing called consensus on strategy among all black communities before we can take action? I suggest to you that that's kind of the backhand end of racism. This is social justice and social change work, hence there will always be disagreements and upset. But let this not deter us from the common goal, to collect race-based data so that we can bring the disparities and the outcomes to light for the purpose of creating equitable change. Also, as this system is, doing this work is change work, we will not always get it right. So let's not have others seek to throw away the entire project and vision because of implementation imperfections. Let's instead learn from failure. Constantly building on what went before and taking the learnings from our failures for continuous improvement. We have Health Quality Ontario. It's always about continuous improvement. So why can't we take that same lens to this piece of work? We says it must be perfect, and I say no. Build on Health Quality Ontario. They talk about continuous improvement. Let's use that same framework. The collection of race-based data. I'll soon be finished, people. The collection of race-based data and advancing anti-black racism strategies is part of, I think, in parts of Ontario, is being discussed a lot in certain quarters. But I think we need to translate that into effective action to ensure delivery on equity. Good intentions without actions will not give us the change we want and we need. We need to develop, I think, province-wide strategies to build awareness that the importance of collecting race-based data and show that the data will be used to ameliorate disparities, and that we also need to reveal that we also need some processes that's not just about collecting the data, but I think we also need some processes to collect the experience, because there is the quality of care and there is the standards about how that care is, there's the standards about the care, and then there's the quality of how that care is delivered. And those two things can be quite different. Yeah? So there is a standard that says all black folks must get X, Y, and Z. And it's delivered differentially to respond to the disparities. But if you have somebody who's delivering that care and that standard with a certain attitude, then it makes the standard of care inaccessible to us. So we need to also measure what is our experience of the healthcare system. And Notisha uses the words of show that you care in how you use the data. So I think that needs to be one of our marching orders. And Sophia kind of gave a summary of the pieces and the elements that the geographic facilitators are kind of scribing here for you in art. So I believe that the health of Black people matters, and that it is our collective responsibility to improve the conditions for those who have experienced historical and contemporary injustices. And a sister used the word liberation, and I believe that the work of liberation and righting wrongs is never done. That collecting race-based data, collecting socio-demographic data that can be disaggregated by race is a tool that we can use to address those sites of inequalities and those sites of wrongs. Hence, I believe that we must be relentless. We in this room, we, our allies and communities outside of this room, that we must be relentless in pursuing the strategies that will bring improved health outcomes for Black communities. And I thank you deeply for spending the time in this conversation and being here in the room at the end of the day. Thank you very much.